Hello everyone, this is the Mental Health for Life channel. This time, we'll be talking about forgetfulness brought on by depression. Due to the popularity of some TV dramas and movies, many younger people go and seek treatment for forgetfulness, suspecting early onset Alzheimer's disease. However, dementia among young people isn't rapidly increasing. Most of the people end up not being diagnosed with dementia, but with symptoms of depression or stress. In many cases, it turns out ADHD people's inattention that's inherent to their condition is to blame, and stress at work likely exacerbates those symptoms. Forgetfulness isn't exactly well known for being a symptom of depression or stress. Even so, in some cases, forgetfulness could be a more conspicuous symptom than other typical depressive symptoms, such as a general sense of feeling down. In the case of depression with older people, discerning between that forgetfulness and dementia can be somewhat difficult. In some cases, people only detect their depression because of those experiences of forgetfulness. The forgetfulness induced by depression or stress can manifest in some of the following ways. At work, you might make many minor mistakes like typing errors, forget important assignments, have difficulty remembering people's names or procedures and tasks, and what people tell you keeps slipping from your mind, and so on. In your private life, you might forget PIN numbers, forget to take your wallet with you when you leave, or to turn off the gas, and maybe you accidentally buy the same thing repeatedly. Apart from forgetfulness brought on by dementia, forgetfulness brought on by depression or stress is caused not by impairment of mental faculties, but by the impairment of overall brain function and lower concentration capability. Your memory isn't completely lost, and it can be retrieved if you focus. If you remember eating a meal but can't remember what you ate, but you instantly recall it after your family tells you about it, that may be a symptom of forgetfulness derived from depression or stress. In the case of dementia, you won't remember the entire activity of eating the meal, and you won't recall it even after your family tells you so. People suffering from depression or stress worry about dementia when they become forgetful. But for people with dementia, forgetfulness is not a large concern, and they remain rather indifferent. Because of this, it is said that 90% of people seeking medical advice for forgetfulness end up not being diagnosed with dementia. People with dementia do not register their forgetfulness, and they rarely visit clinics on their own initiative and are often brought in by family members. The causes for forgetfulness are not limited to dementia, depression, or stress. Excessive use of smartphones, games, and alcohol, as well as lack of sleep can cause it too. In rare cases, brain tumors or thyroid diseases might be another cause. Medication for allergies, diabetes, or sleep might also cause forgetfulness. If you experience forgetfulness over the course of treatment while your other symptoms of depression improve, then sleeping pills or other medication you're being treated with may be affecting your memory. Forgetfulness is also a natural phenomenon of aging. If you are in your 50s, don't panic if you are having trouble remembering people's names or new information. On the other hand, if you forget things frequently and your work or study is being disrupted because of it, please take note and be careful. It's necessary to review your life habits and rebuild them by refraining from excessive use of smartphones, games, getting a good night's sleep, reducing your alcohol intake, and making sure to take enough holidays. If those changes still do not help, then it would be wise to consult a professional. This was the Mental Health for Life channel. If you liked this video, please give it a thumbs up and subscribe to our channel.